Welcome to Around Town, and you know how much we like to celebrate our small businesses of the month. They were doing a great job here in the Rocky Mount area, and Joey Keenan, who is the incoming chairman of the Small Business Committee, is joining us. So welcome to you, Joey.
Thank you.
And we are with the current senior members of Nash OB-GYN, the January winners of the month. We've got Dr. Dennis Van Zant, welcome to you, and Dr. Mel Fryer. And there's one more senior one who's a no-show, right?
Yes, Dr. Crockett had to leave, but he
is
the senior partner.
Okay, well, we will tease him next time we see him.
Sounds good.
Dr. Van Sant, give us the history of Nash OB-GYN. Who were the founders?
Well, Nash OB-GYN was started by Dr. Ben Morgan and Dr. Jim Thorpe. They came together, they had separate practices, and in 1973 they joined together to begin Nash OB-GYN.
And wow, I guess Dr. Thorpe, of course, has seen this facility, but there have been a lot of changes since then, haven't there?
There have been. Lots of doctors. Dr. Cronkey joined them in 1975, and then there's been Doug Boyette, who was with us for a long time.
Right.
And then retired, and we've added Dr. Fryer, and there's Dr. Collins, Dr. Chandler, Dr. Payton, and
that shows you're really busy to accommodate that much staff. And of course, we're going to meet a lot of the behind-the-scenes staff too. But
yeah.
And I believe you moved over, Dr. Fryer, right when the practice you had been with decided to go all GYN.
Yeah, my three partners at the time decided they were tired of being up all night.
But you weren't?
Well, family issues mandated I continue to work for a while, and so I joined here almost 9 years ago now. They were very accommodating. It was about the same time that Doug Boyette was unable to continue doing obstetrics, and I think they needed somebody in that age slot. So Doug and I were pretty close in age, and they've been very accommodating, and I've enjoyed it quite a bit.
Well, good. Well, let's take a look at the presentation of the banner, and then we'll be back to talk some more. We want to meet the rest of the physicians here.
I don't see you. There you go.
Good looking shot.
Now, ladies on this side, spread out, just back up to the counter. Back up, back on up to the counter. There you go. But don't, there you go.
Can you see the side?
Me?
Second lady, come back. There you go. 3, 2, everybody smile, say yes. Everybody say no.
This is Joey Keenan on behalf of the Chamber of Commerce. We'd like to congratulate Nash OB-GYN on being the January Small Business of the Month. You know, this is a really important event. A Small Business Committee has, chosen them as the Small Business of the Month for January, and for all their service that they've done to this community, we really appreciate everything they do. I know personally my wife has been here multiple times in the last 8 months, so I can attest to a great job that they do, and really happy and pleased, and we really support them, and we appreciate your support of the community. And I'm going to turn it over to Dr. Van Zant to give us a few words.
We're very excited. The group Nash OB-GYN has been in the community since Dr. Morgan and Dr. Thorpe came together and started this group, and then young Dr. Conkey came along, and it's continued to grow, and we really appreciate the honor that you've given us. We want to continue to provide the best care that we can for the citizens of Rocky Mount and surrounding areas, for obstetrics and gynecology, and however we can support this community so it continues to grow and hopefully continues to be a strong influence in the area. And thank you.
And once again, congratulations, and I want to say thank you to all the Chamber ambassadors as well, and thanks for everything you guys do, and we appreciate it. Congratulations again.
Okay, we're joined by 2 more of the physicians here, and I believe there's one, Dr. Collins, who was up all night delivering babies?
Delivering babies all night, yes ma'am.
Do y'all have babies almost every night, or how does that,
I think it's a rare night that we don't have at least one baby.
How about that? And then Dr. Christine Payton.
Yes.
And Dr. Chris Chandler.
Yes ma'am.
Okay, and y'all are both from West Virginia?
We are. We grew up within 30 miles of each other. Kind of like that movie 7 Degrees of Separation, like we almost met like 5 different times.
Uh-huh. Well, and Joey's wife is pregnant, and we've been talking a little bit about that, but do people coming through see each of you at some point to kind of, so they don't know who will be delivering?
Yeah, they have one OB provider that's their designated primary provider. They see them most of the time, but they do rotate around to see all of us at least once.
How were we lucky enough to get you, Dr. Payton, to come to Rocky Mount?
Well, my first job out of residency was in Delaware, and then my brother and his family moved to Greensboro, so I was looking for a job in North Carolina, and the practice was advertising, and they decided they liked me, and I liked them, and here I am.
What's the feedback you get from, are there some women who specifically like a woman?
There are. Most of my patients specifically want a woman.
And most of your patients specifically want a man, is that?
Either that or they don't have time to wait for Dr. Payton.
Well, and you, where did you go to medical school?
Went to medical school at West Virginia University.
And did your residency up there? Or
I did my residency in the Navy, and then did 8 years, and 2 years in Japan, 4 years in Virginia Beach, and 2 years in Charleston, South Carolina.
Wow, so you settled into Rocky Mount, and Joey, we were thrilled that they both live here, right?
Certainly. And my wife has seen both these doctors, and they've done a great job, and we really appreciate all the hospitality, and they do a great job.
Well, and what a wonderful place to live. I mean, not only live, but to work at Nash OB-GYN, kind of having a different staggered age groups.
Yes, absolutely.
Working here. Kind of comment on that.
Well, it's nice to have everybody has different experience levels, doing different residencies at different places, and people have different experience levels. Obviously, some things you read in the book but you never see, but maybe some of your colleagues have seen it. So that does help to run ideas by them.
Are there different things like robotics or laparoscopy or anything like that some of you do more than others?
Well, Dr. Chandler and Dr. Van Zandt both do the robotics. I currently don't. And most all of us do laparoscopy and minimally invasive surgery. We also have one day a month where we do minor surgery here in the office as well.
Minor surgery like DNCs or that?
Like
type of
Novasure ablations, E-sure tubal ligations.
We don't know what those are, do we, Joey?
No, ma'am.
But good for you. We're glad you do. Well, thank you so much for all that you do.
And thank you all for having us.
Oh, sure, and congratulations.
Thanks so much.
We have Amy Winston. And Amy, you do, I'm going to say it's midwifery.
Yes, ma'am.
Wow, how'd you get interested in that?
I wanted to go into some type of advanced nurse practice field, and it was the only advanced nurse practice that could deliver babies. So, and East Carolina is the only midwifery school in the state.
So what was your background before taking the courses to do that?
I worked at the hospital as a nurse in telemetry, IV therapy. I was a lactation consultant, worked in labor and delivery, postpartum, and also was a perinatal educator here at this practice prior to finishing school.
And then went back and took the coursework to be able to do that?
Yes, ma'am.
How is it being received? Do you have a lot of people who say, yes, I'd like to do that?
It's really an old term, which the term midwife means with woman. And a lot of people think of the lay midwives that go into the home, but this is actually the way I practice here is more of the trendy type of modern midwifery, where you're working as a nurse practitioner that has the abilities to deliver babies in hospital with, you know, whatever the lady likes out of the experience is what I want to be able to offer. So if she's wants epidural and, you know, any type of birth plan that she has we can accommodate, I can do that. So
and it's in the hospital, so you've got all the safety backups.
Right, you've got the safety backups. There's always a surgeon there with you. There's always OB provider there that you can get within a matter of minutes. So anytime, and I keep open communication with them throughout the entire labor so they're aware of what's going on.
It's nice to have, I mean, Joey, it sounds like this practice offers everything.
It does.
His wife's in the final stages of pregnancy, so he's learning along with this. But that's great. And how long have you been able to do that with Nash OB-GYN?
I've been a midwife with them since June.
Okay, well, great. Well, we're going to take a break, and we're going to meet a lot of the behind-the-scenes people, not behind the scenes to the patient, But Kim is going to introduce us to them, and then we're going to talk to Dr. Van Zant and Dr. Fryer and learn a little bit more about what your many contributions to the community. Stay with us.
Are you just starting out on your own and want to be independent? Do you have a family and need a bigger home? Are the kids moving out? And are you downsizing? First Carolina Realty can help. A 1- or 2-bedroom apartment or house for those starting out. A 3- or 4-bedroom home for a growing family. Rentals, sales, new homes, pre-owned homes, investment property in the city or in the country. Call First Carolina Realty. Now is a good time to make that move. Real estate prices are right, interest rates are low, and there is a fantastic selection of homes available. First Carolina Realty is a full-service licensed real estate firm with offices located at 1100 West Thomas Street, open 9 to 5:30 Monday through Friday. If you have rental properties and are tired of the headaches associated with managing them yourself, or if you're looking for a new management team to manage your rental properties, call First Carolina Realty at 252-985-2321. Visit our webpage at firstcarolinarealty.com. We will gladly help you with all your real estate needs.
Hi, I'm Jean Almond of Almond's Drugs, and I want to invite you to be Almond's customer for your prescriptions. Our average pharmacy wait for your prescription is only 10 to 15 minutes. We have drive-through windows at both locations. We will deliver your prescription free. Our friendly and very experienced pharmacists specialize in consultation, and we are locally owned and have been a loyal part of your community for over 70 years. Just make one phone call to us and we'll make the transfer so we can start taking care of you. Okay, Kim, we want to meet a lot of the staff here. Can you introduce them to us?
Certainly, I'd be happy to.
First we have?
This is Ellen Joyner. She's one of our registered nurses, and Ellen has been here for a number of years helping take care of our patients.
Yes, I've been with the practice since 2008. Actually started as an LPN, and then once I graduated with my RN, was very fortunate to be offered a job to stay, and have been here. I work mainly with Dr. Payton when she's here in the practice, but I do assist all the doctors in taking care of our patients.
Great, and I'm sure you're probably the face they remember as much as anybody because the nurses are the ones who kind of are there all the time, right?
We do try to be there for our patients.
Great, yes. Thank you.
Thank you.
Okay, next we have?
Next we have Paula Barnes. Paula has been with the practice for about 13 years now. She is one of our sonographers, so she is the lucky lady who gets to take pictures of our babies. And
so the first picture they see of their babies often is something that you're showing them?
Absolutely, and the technology has gotten better with each year that comes by, and we offer the 3 and 4D ultrasound, so you really get to see what your baby looks like, and it's really exciting for the family.
Do they get a copy of it to take home for the first picture?
They do, and we also provide a CD for them that they can get video clips, as well, and they enjoy that.
Sounds pretty high tech, isn't it?
It is.
Thank
you. A lot has changed in the years that I've been doing the ultrasounds.
Okay,
it's really
thank
nice.
you.
Thank you, Paula.
And we have?
Next we have Erica Arias. And Erica is relatively new to Nash OB. She's been here for about 9-10 months now. She works in the administrative staff. She assists our patients with scheduling appointments, when they arrive in our office, getting checked in, collecting their insurance information so we can assist them with filing claims. So she's in our patient service area.
Oh, good. Had you done that prior to coming here?
Yes, I have.
So good. Well, they were lucky to have you. Are you enjoying your job?
I am. I really do like it here.
Well, good. Yeah, it's a happy place.
The staff.
Isn't it?
It is. The staff, the patients, I really get along with everybody. Yes.
Great. Thank you.
Thank you.
Okay. Next we have?
Next we have Teresa Davenport. And Teresa has been with us for
almost 10 years.
Almost 10 years now. She works in our insurance and billing department. So Teresa is the one who really works with our patients in helping them get their claims filed and assisting them with their benefit information and helping to provide a necessary part of that whole patient encounter and taking care of the financial aspect of things.
It's not, you don't have an easy job.
No, ma'am, not all the time.
But I bet people really appreciate how much you help them because they need that assistance.
Yes, ma'am. There's some people that really don't understand the process of their insurance, and we're here to help them to better understand their policies and how their insurance are paying and why they don't pay. So.
Well, good. Well, thank you for all you do.
Thank you.
Okay.
Next, we have Joni Brantley. Joni is the Director of Business Operations. Joni is the backbone of Nash OB in terms of the number of years that she's been here. Joni's very well versed in not only administrative, but some clinical operations as well. So she's been a very integral part of Nash OB for a number of years.
So were you here when the first, like Dr. Morgan and Dr. Thorpe were
I came in 1996. I've been here about 18 years. So yes, Dr. Morgan just retired when I came to work here. So I did work with Dr. Thorpe and Boyette and all them.
And Cronky, you've seen them all come.
I have. They're a great group of physicians to work with. I wouldn't have been here this long and continue to want to be here.
And I bet this new facility has been really helpful, hasn't it?
It's fabulous. I mean, it's just phenomenal to have all the space, and it's so beautiful. I mean, patients think they're in a hotel now instead of, compared to where we were before. It's much different, much better space. So.
Well, thank you for all you do.
Thank you.
Okay.
Next, we have Danielle Williams, who is another one of our patient services representatives. Danielle's been with us for about 3.5 years now. She assists patients with the check-in process and getting that first step into our practice and getting their needs met.
Are you enjoying your job?
I enjoy my job. I try my best to keep the patient's weight as comfortable as possible, and I enjoy the kids that come with them as well. I'm known as the sticker lady. Yes.
Oh, cool.
Yes.
So a lot of them do bring their kids with them.
They do.
And I like to keep them comfortable too, because when being pregnant, it's not always real comfortable.
I have crayons, coloring books, and stickers. To keep them comfortable and happy.
Great.
Yes.
Well, thank you.
Thank you.
And last but not least,
we have Beth Bullock, who is another member of our insurance and billing department. And Beth's been with us for about 11, close to 12 years now. So she's another integral member of our billing and insurance staff.
And you've had to stay on the cutting edge. I mean, things have changed a lot through the years, haven't they?
The insurance companies are, you learn something new just about every day, seems like. Something always changes.
And I bet they really appreciate that you're helping them sort this out. I mean, to be on your own, if they had to do it themselves, it's almost impossible.
It is. It can be confusing to a lot of patients. I mean, young and the older. But like I said, we're always here to try to help them, and we do the best we can. So.
Well, that's great. Thank you.
Thank you.
Okay. We're delighted to be joined by Marissa Dempsey and Martha Wells. And you ladies kind of have your own special niches. And I think, Joey, you have even been in classes with some of them, right?
We have. My wife and I, we've seen both of you a lot here recently, with the last 8 months. And it's been great. They're two wonderful ladies, and they know a lot about what they're doing.
Well, Martha, you want to start with telling us what your role is here?
Certainly. I am the nurse educator, the perinatal nurse educator, and my initial contact with patients is at their first OB visit, where I take a history and then spend a fair amount of time educating the patient about how to take care of themselves while they're pregnant and what to expect during the course of their pregnancy. I also see the patients later in their pregnancy and discuss labor and delivery preparations with them as they approach their due dates. I also have the opportunity to teach the breastfeeding class. And this is a class for parents who may be coming as inquirers about breastfeeding, not exactly sure about their decision of how they will feed. Also, some parents have already made that decision about how they'll feed their babies. And in that class, we cover the very basics of breastfeeding because it is a very extensive topic. But my goal for them is to leave the class prepared with the basic techniques on how to get started with the breastfeeding experience and how to develop a positive relationship with their baby in regard to breastfeeding.
Are you finding that more and more women are breastfeeding than used to?
It still seems to be a very personal preference. There were periods of time in the past where there was an increase and then maybe a decrease, and so it kind of is an ebb and flow situation, but I think dependent upon their personal situations, more people are maybe beginning to choose to breastfeed.
And I share the benefits for the baby and the mother of
absolutely. That's one of the very first things we do in the class is to talk about the benefits of breastfeeding so that they can understand not only for themselves but also for their babies what the benefits are, and they're numerous.
Oh, they are. And Marissa, I have known you a long time, and what do you teach to the patients?
I teach childbirth education. It's a 4-week class where we meet 2 hours every Monday night for 4 weeks, and we just educate. My goal is to educate, empower, and encourage families on their journey of birth. So it's a very, we try to give all your options. We talk about unmedicated births, different medications, pharmacological, non-pharmacological comfort techniques. We tour labor and delivery and let them see where things are going to happen, and also discuss cesareans and newborn care.
What about the nurse midwife? Do you talk to them about the possibility of a midwife, and how does that come into play for whether they choose that?
Well, at the point that I see them, they already have their primary, but of course, you know, midwifery care is an amazing source of care. So we discuss what that means. Not all of them know what it is when they say, "Oh, you're going to have a midwife," but you know, I love Amy and support what she does fully. So. So we do discuss that during the class, yes.
Joey, what did you learn from all this?
I learned a lot. There's not enough time in this video, but she does make it easy, and she makes you feel more comfortable, especially a first-time dad like me. I feel a lot more comfortable going into it, taking a few of her classes. So I think they're great and a great use of the time.
So y'all are a success. Yay! Yeah. Thank you for all you do.
Thank you.
Thank you. And now we're rejoined by Dr. Van Zandt and Dr. Fryer. Let's kind of show people who haven't had the privilege of being here yet a little bit more about your facility. It's beautiful. It opened in 2010?
2010, yes. We moved from our facility we've been in for about 20 years.
And more room, more everything.
More room, brighter colors. We've been able to add a room where we can do minor procedures. And we have 2 ultrasound rooms. We've got a laser treatment room for laser hair removal and skin rejuvenation.
Oh, so you take care of the whole woman then? I mean, there's add-on services. Good.
Yes.
And in walking us through their like extra examining rooms, what you used to have?
Yes, we've got
do you still have the stirrups? I mean, can you find a way to get out of the stirrups?
Can't get rid of those. Can't get rid of those yet.
Oh, okay.
So, but yeah, the facilities offer, I believe, 23 exam rooms.
Wow.
We also have 2 treatment rooms in addition to the minor surgery room.
And Dr. Fryer, you're OB-GYN, but some people you see are GYN. They were OB and they're not OB anymore. So you keep y'all are also considered primary practitioners.
We do quite a bit of primary care for individuals who don't have extensive medical problems. You know, we can and quite frequently will manage thyroid issues as long as it's not too complicated. We will manage some blood pressure issues on occasion. We see a lot of folks for, you know, upper respiratory situations. We offer flu vaccines here, not just for pregnant ladies, but also for our gynecology patients, supply willing. Sometimes we get short. So we try our very best to make it a place where they can get the care that they need, as long as it doesn't require super specialty care for somebody who might need 3 or 4 different medications for thyroid disease or hypertension or lupus or something of that nature. We feel that they're better suited to be seen by specialists in those areas.
Joey, one of the things that were real important to winning this award for the Small Business of the Month is doing some public service. And y'all have done Relay for Life. You've always had great sponsorship for that, haven't you?
Yeah, and we've also, in addition to having done that in the past, actually have a member of the staff, Allison Mills, who had breast cancer, and she's actually been a focal point for that. We've provided lots of fundraising through lunches and things like that to get to where we need to for the Relay for Life.
And Fun Run, y'all have participated in that?
Yes, ma'am.
And I have to say, because I know Dr. Doug Boyette and you all, and I see you individually, not just as a practice, the people who work here really care about the community. And so while the business might not get credit for it, thank you very publicly for the fact that you all care deeply about this community, and that we have seen you all doing a lot of volunteer work personally too.
We do love the community. We live here. We see our patients in the grocery store and the drugstore, and we just want to make sure that we're doing the best that we can for them.
Well, great. Congratulations.
Congratulations again. Thank you very much.
Thank you, and we'll see you next week.